Welcome everyone to a presentation on Endologica, a new vision of prescribing medicinal plants. I am so excited to be sharing this information with you today. This is not just a plug for a product line. I want to share with you a new way of thinking about plants and how plants can be combined and how you can help your patient on many different levels. In this talk, we're going to learn about the product line, review the technical sheets, learn the health sets, which are groupings of the individual products for specific types of protocols. And then we'll go through a case study to illustrate how we can apply this new way of thinking. Let me introduce you to the Endologica line. It's 6 products that are featured here, and it can be used to address hundreds of different disorders. The reason it can do that is because each of these products is combined to address a specific combination of imbalances that are related or at the foundation from an endobiogenic perspective of hundreds of different disorders. So we have autonomic and central nervous system and brain stem support. We have endocrine support across all 4 axes, but primarily focused on corticotropic and thiotropic. We have microbiome, digestion, and metabolism support. And we have support of all the emunctories, major and minor. Now, just to maintain the overview for a second, you'll see here that these products are color-coded, and the blue are the corticotropic family, and the red and pink are the thiotropic. Toniquel green is the gut-brain axis, so it's autonomic nervous system, enteric nervous system, digestive organs. And then Seraphyn is for strong neurotransmitter support. And we'll get to the details of these. So what is this new approach to medicinal plants that we're talking about? It's about treating the whole person. And that means, of course, treating the illness the patient has. This is what we learn in medical school. This is probably what you learn in naturopathic medical school as a medical herbalist to treat the illness. But from an endobiogenic perspective, a patient is more than just their illness. So we need to treat the person who has the illness, which is, of course, what Hippocrates said thousands of years ago. But beyond that, we also need to treat the psychology of the illness, because treating the physiology without treating the mindset that either disturbs the physiology and promotes the disease, or which perpetuates the suffering of disease, is going to lead to roadblocks if you don't address these psychological issues. So, one approach, for example, in the case of migraines, would be to just treat the migraine. And so here, you would use plants like butterbur or feverfew, or you'd use some anti-curcumin to reduce inflammation in the blood vessels. And that's not wrong. But there's a person who is suffering from the migraines, and there is a very specific endobiogenic terrain. So, for example, in this case, it involves elevated cortisol, elevated sympathetic activity, and a type of neurotransmitter imbalance involving GABA usually, and GABA insufficiency, sometimes serotonin insufficiency, excessive dopamine. The rate of cerebral metabolism is driven so high it exceeds the body's ability to provide it with glucose from the liver. And that then triggers the migraine pathophysiology that we are addressing here in the standard approach. But obviously, if you treat the terrain of this person, you won't need to use so much of these rescue medications or symptomatic interventions. although sometimes they are necessary to add on. And then there's an inner life, psychologically speaking. So this person feels like this, overwhelmed. They feel sometimes just stuck and frozen while their mind is racing and they feel the world around them is racing. So what we're looking for is a more sensitive way of prescribing, which can extend to all three levels of the reality of the patient and their illness. So when we talk about treating the person who has the illness, we're talking about a fundamental endobiogenic approach of treating the terrain, which means the systemic root cause of disease. It means also addressing the symptoms and their mechanisms downstream. But it also includes the drainage of the key emunctories by the different adaptation types. What I mean by that is in this example of migraines that we talked about, a person who's a high noradrenaline, a high alpha, high cortisol type with GABA insufficiency, this high cortisol creates a lot of catabolism, creates a lot of inflammation, and there's a high demand for the liver to clear these inflammatory proteins. So the liver and then secondarily the kidney are the most implicated organs in a high cortisol, high alpha type of person with this type of NF-kappa B and interleukin driven inflammation, as opposed to, say, a low cortisol person who tends to have high histamines. And yes, they do have a demand on their liver and kidney, but there's also a stronger implication, for example, for the pancreas and secondarily the lungs in that low cortisol um, type of patient. So knowing which emunctories are the primary, secondary, or tertiary for a whole group of disorders is a very endobiogenic way of thinking of drainage. And then we want to restore the buffering capacity of the patient for long-term resilience. This means improving their general adaptability. And this can be done with adaptogens like Eleutherococcus or Rebus nigrum or rhodiola. And of course, it could be done with judicious selection of vitamins and minerals that are either in a synthetic encapsulated form, food-derived encapsulated form, or through a judicious nutritional plan. When we talk about the psychology of illness, we're talking about two aspects. One is the attitudinal complexes of the personality of the patient, where the mind, perception, and emotional response to perception of events creates a destabilization of the physiology and really favors or fragilizes, as we would say in endobiogeny, the patient and makes them more susceptible to developing the flare-up or a new onset of disease. So there's this underlying psychology that's associated with certain types of disorders that you want to address, but also the psychological response to the suffering that the particular disorder or disorders that they'll have bring on. Now, I haven't said explicitly how this line does that, but let me tell you now that each plant in each formulation has been carefully selected, and there's always two or more plants which have very subtle and nuanced psychological and psychophysiologic actions on the mind and on the brain. And this is how it starts to differentiate between very specific types of anxiety versus worry versus perseveration. And this is how it's going to contribute to addressing the psychology of illness. One of the other reasons that this product line is not just a new line of products to consider is the fact that Endologica is created out of the endobiogenic spirit and is created to fit into the ecology of endobiogeny. The name itself indicates that because the endo in Endologica refers to endobiogenic wisdom, and the logica refers to the logic of the GEMMA biomarker assessment based on the biology of functions. Because what we've done for the first time in human history is to precisely codify into mathematical rules an association between a symptom of integrative physiologic actions and specific medicinal plants, mushrooms, and other interventions which are rationally, numerically, and clinically related to the condition that's being treated. So put another way, there's no more guessing that's necessary. Oh, should I use rhodiola or should I be using magnolia? Should I be stimulating or should I be inhibiting? Should I be using birch or should I be using burdock? The guesswork is taken out of this. Of course, this doesn't take the place of your empirical or intuitive assessment of the patient, your feel of the wholeness of who they are. It's just simply to say that as a product line, as a way to select products, there is a reliable, rational, but integrative and holistic method of thinking for why the plants were combined in the specific ways that they were combined. So why this line? It's the first endobiogenic supplement line. It fits into the ecology of endobiogeny, which has you, the community, at the heart of it, but involves endobiogenic training, JAMA testing, and now endologica treatments. Because to know how to perceive, to diagnose endobiogenically, but not be able to verify it in a rational, modern, numerical way can put you at risk of some errors in your perception or assessment. We all need to keep it real. And keeping it real for me means using JAMA testing to numerically and mathematically validate what I can perceive through my anamnesis and examination and what I cannot perceive through these tools. I have no idea if there's free radical activity. I can surmise it, but even if I suspect it's there, I don't know exactly how much. I can't quantify it in my mind with my intuition, but the JAMA system can do that. And then you can objectively follow the evolution of the harmful free radicals, of the degree of anxiety, of the degree of allergic tendency. Well, you can follow it over time and objectively say, yes, I am making an impact in this condition and in this process. Now, the Endologica line is created for all prescriber types. For those of you who are new to the use of medicinal plants, let's say you're a medical doctor or you're a nutritionist, and you've had either no training or little training in the use of medicinal plants, then Endologica is a helpful tool for you to start prescribing and getting the results that you're looking for based on your endobiogenic perspective and perceptions right away. Because you're going to be benefiting from my 20 years of custom formulation and I'm really going to be standing behind you every time you recommend these products and saying, that was a good choice. If you're an intermediate prescriber, so let's say you don't have a dispensary, but you call in some custom formulations, or you're very discerning on how you recommend off-the-shelf encapsulated products, for example. By studying the plants and by reading about them in the Gemma Materia Medica, by thinking about why I combine them the way I did, you're going to become a master formulator, and you're halfway there, and this is going to accelerate the course of your mastery and shorten the number of years you'll need, because you too will start to see the patterns that I've noticed, and you'll see how these combinations of plants are effective for so many disorders, and how it's going to greatly simplify your treatment program. Now, I think those of you who are master formulators already, and I know there's many of you out there, and some of you may have been my students, and many of you may be medical herbalists, so you really know your plants. And I realize that for some of you, it's anathema, the idea that you would need somebody else's combination or somebody else's thinking to improve yours. And that's not what I'm saying. What I'm simply pointing out is that there are certain conditions that so consistently have the same types of physiologic imbalances. And in my experience, so consistently respond to a limited number of plants that you can focus on a highly personalized treatment for very complex or unusual presentations, and you can add the Endologica synergies or formulations into your custom formulation and start to have these additive effects, which are going to be very interesting. And it saves you a lot of time as a master formulator, because there's less time you need to gather the individual plants and measure them and mix them and individually price them out. So there's actually some other advantages that we can talk about if you're a medical herbalist or other type of master endobiogenic formulator already. Right. Now, for those of you who don't use Gemma, or Gemma is not the first test you go to, that's okay. Because the Endologica products and the Endologica catalog have been created to help you identify findings in other types of functional testing systems that would indicate which Endologica products to use. And we'll go through some details. But just for now, I'll point out that you'll have recommendations for salivary cortisol, for hormone testing, for Lyme serology, different types, subtypes of Lyme disease, for urinary neurotransmitter results, for fungal metabolites, and for indications of intestinal inflammation and imbalances in the gut microbiome. So completely uncoupled from GEMMA testing, even uncoupled from endobiogenic thinking, you can use these products just based on the results of these functional testing tools. Another advantage of the Endologica line is the fact that it's a liposomal preparation. So if you're not familiar with liposomal preparations, there's a fat. In this case, we're using sunflower-based lecithin. So this is soy-free. And the lecithin is added to the tincture and agitated using a proprietary ultrasonic waveform. It agitates all the molecules, and then all the individual molecules of the tincture get wrapped in the lecithin, and they form this liposomal body. And so this liposomal body has a special affinity for the intestinal lining. It can be easily absorbed through the lymphatic system, through the mycels, and it can directly enter into the bloodstream and avoid hepatic first pass metabolism. And once it circulates in general circulation, because of this liposomal shell that the tinctures are now wrapped in, it more easily and passively passes through the cell, the lipid bilayer of the cell, to enter into the cells. So you have better absorption, you have faster action. The tinctures not only are liposomal, but they're 10-time concentrates. So we're talking about drop dosing. For example, for an adult, the typical dose would be 6 to 10 drops. We're also talking about convenience. It has a pleasant taste. There's no need to swallow capsules. So if you have a patient who's a child who cannot swallow capsules, or there's approximately 40% of adults have difficulty swallowing capsules or gag when they try to swallow. And there are many adults and children who are sensitive to the taste of a non-diluted tincture. So when you're asking them to take 5 milliliters or 7.5 milliliters with all that extra alcohol, it can be unpalatable for certain people. Here, 90% of the alcohol has been removed and 90% of the water. So it's more concentrated for those who are recovering alcoholics. They don't have to worry about any significant alcohol exposure. I mean, there's a very small percentage. The other thing is that we're using high quality Austrian cobalt glass bottles, not cheap bottles from China. And we're using leak resistant silicone bulbs to make sure that the products travel well in your purse and your gym bag, that they travel well when they're being shipped around the world. And the silicone bulbs, well, I guess I can show you right now. Here's Toniquel. You see here it has this nice silicone bulb. This is a high quality Austrian made cobalt glass, and it has this integrated dropper, and these tiny little drops come out. Are there any questions at this point before we go over the line?
Not at this time.
Okay. So I'd like to explain how the line is organized. We have 4 basic divisions. We have a corticotropic line, a thiotropic line, an autonomic nervous system line, and central nervous system. Now these categorizations are arbitrary because every single one of the products, as you'll see, is going to have they can have multiple endocrine actions going across just multiple axes. They all affect the autonomic nervous system. They all have some neurotransmitter or digestive. They all have emunctory support, but different emunctories predominate. But in general, I'd like you to think about it like this. The products with the blue labels are generally and most strongly focused on the corticotropic line. And we have Catavance. And here, the idea with the corticotropic line is that cortisol advances, is catabolic. So Catavance is advancing the catabolic capacity of cortisol or the adaptive capacity. So think about Catavance when you're to advance a low cortisol state into a normal cortisol state to improve cognition, immunity, digestion, mood that is affected by a low cortisol state. And then conversely, we have Cataquel, which quells or reduces high cortisol state and the associated tendencies towards brain fog, inflammation, the need for a stronger level of detoxification, anxiety, and depression. The second group is thiotropic. So in a similar way, we have Levovance. Here, I want you to think about levothyroxine, the substitute, the T4 substitute. So here, Levovance is advancing low thyroid activity. So this includes standard states of hypothyroidism, as well as autoimmune hypothyroidism, as well as functional hypothyroidism, SICU thyroid, any of these states. And because it's improving the general thyrotropic efficiency, It's also going to be improving metabolism, metabolic rate, cognition, immunity, etc. And then conversely, we have Levoquel, which quells a high thyroid state. So especially when you have high TRH, which can be related to anxiety, perseveration, traumatic rumination, stronger somaticization of anxiety, arrhythmias, inflammation, pancreatic overstimulation is all associated with TRH. But also classical hyperthyroid states like Graves or Bastow's disease, so from high T4, high T3, or if you have a low TSH, which is very important in endobogeny in playing a role in the development, for example, of uterine fibroids, of various cystic disorders, of fibromyalgia, of chronic fatigue syndrome, also brain fog, inflammation, again, a higher need for detoxification and anxiety. The autonomic nervous system focus line is covered by Toniquel. So here we're talking about the tonus on the system. So this is autonomic tone, enteric nervous system tone, neuromuscular tone, all these types of things. So it can quell all autonomic nervous system imbalances. So spasmophilia with high noradrenaline, with high leukocyte mobilization index, with low leukocyte mobilization index. It can address high adrenaline, low adrenaline. It also addresses excessive parasympathetic tone. It's a master gut-brain axis regulator. It addresses all the aspects of digestion, the production of digestive juices, motricity of the bowel, intestinal inflammation or leaky gut, dysbiosis, immediate adaptation, which involves the splanchnic bed, and all these things. So it's really quite a profound and foundational treatment. And then in terms of central nervous system and neurotransmitters, again, while the previous 5 products all have good central nervous system support, Seraphyn is very strong and very nuanced in its and very broad in its neurotransmitter regulation. So we're talking about dopamine, serotonin, GABA, melanocyte stimulating hormone, and general corticotropic adaptability. So this is a fundamental brain corticotropic regulator. Now, these individual products can be combined into health sets. So here's, for example, one called Mellow Flow, which is Seraphyn, that central nervous system focused product, and Toniquel, the gut-brain axis oriented product. So health sets represent optimal combinations. They can be used to treat multiple complex conditions. They have very specific dosing protocols that are offered for you. For example, which one of these 2 products or 3 products should be taken in the morning, at noon, in the early afternoon, before dinner, before bed. The way to help you optimize the dosing if you want to go to that level of granularity. The health sets provide a rich clinical picture for you to start to see from an endobiogenic perspective. When you combine different sets of disadaptation tendencies in the body, like someone I mentioned earlier would be a high alpha, high cortisol type. But what if they also have elevated TRH? So they have central hyperthyroidism and they have a mixed peripheral thyroid picture. What does that look like clinically to have all those imbalances? What if it's more of a para-alpha imbalance with a lot of neurotransmitter issues, like in this picture? What does that person look like? The health sets provide a vignette and describe visually and with words what this person looks like so you can recognize them in clinic. And again, even without testing, you're going to know this combination, this health set is right for this patient. I want to get them healing right away before I've even done any testing. It's going to give you psychological insights into your patient and open up a new platform for discussion and for healing. We can again categorize the health sets in certain ways. There's a pediatric oriented one called Grow and Thrive. So this has Catavance, Levovance, and Toniquel. The Catavance is to support weak corticotropic activity. The Levovance is to support weak thyrotropic activity. Those of you who are trained in pediatrics or who see a lot of children know how crucial both corticotropic and especially thyrotropic activity is in the first 7 years of life and the development of the cognitive system. So for children who are on the autistic spectrum, this product is strongly oriented for them as well as other neuroatypical and neurodivergent individuals, especially if they also have a strong gut-brain dysregulation, leaky gut, food sensitivities, emotional responses after eating foods. They have trouble with immediate adaptation. They're rigid. They have trouble with sudden changes in plans. So actually, even if you're an adult who's neurodivergent, this combination could be appropriate. But especially for children who are neuroatypical, neurodivergent on the spectrum, this is a combination that you'll want to use. Also, if they have, as they often do, low-grade fungal infections, or let's say they have congenital or acquired Lyme, all these clusters of things. And again, it's all described in the booklet, and we'll go through it. Now we can talk about a second group in the health set, and these are body-mind. And these are specifically oriented around corticothyrotropic signaling. So Radiant Power is Catavance and Levovance. So it's similar to Grow and Thrive, but it's for people, children and adults, who have less of these GI gut-brain imbalances, and they have much more issues around energy, endurance. They get sick easily, or they get a little brain fog, or they don't feel their best until 10 a.m. They have an afternoon slump. They have weight issues. In older adults, you would think about using Radiant Power as they have a decline in their vitality. You can use it preventatively to reduce the risk of developing Alzheimer's disease, Parkinson's, um, osteoporosis, osteopenia, cardiovascular disease, atherosclerosis, all these sorts of things. Quiet strength is the exact opposite. So the Cataquel is to lower cortisol, and the Levoquel is to lower excessive thyrotropic activity, whether that's central, like TRH, or a low serum TSH, or peripheral, or both. So again, we're talking about a person who's much more in this highly activated, over-responsive stress type. And we have the Seraphyn series. So this is mind body. The central nervous system and autonomic nervous system activity is stronger here. I apologize for the mix-up in the animation. We have mellow flow. So we talked about this earlier. This is a strong CNS, ANS gut. type of access for that type of person. You have Bright Lift. This is Seraphyn and Catavance. Pardon me. So these are for people with like a low cortisol depression who are sad and draggy. So they're basically weak cortisol people who also have some particular neurocognitive feature that would benefit from stronger support with Seraphyn than just what Catavance alone could bring. And healing self is for the most profound level of high activation burnout. So, excuse me, this is incorrectly written. This should say Cataquel. You'll pardon me. So this wells high cortisol. Again, I apologize for that. All right. So this is for someone who has neurotransmitter depletion, who has high cortisol activity, has a high sympathetic tone, overreactive parasympathetic, which is can't match the sympathetic tone, etc. Now, in terms of dosing guideline, I want to talk about dosing because I appreciate that people trained in different traditions have been taught to use different galenical preparations. So let's say fluid extracts of dry plant material versus a mother tincture or a gemotherapy extract of fresh plant material. And there's different approaches to dosing as well. Let's talk about an endobiogenic approach. We can talk about three levels of dosing. The first is regulating, and this is for when a person is generally doing well and you want to maintain this optimal physiology. This is going to be the lowest level of dosing, and you could use this for prevention, maintenance, or when there's still some imbalances in the pre-critical terrain where a person could get sick if a new stressor comes about and you really want to help prevent a known disorder from flaring up. There's managing level dosing, and this is when you need to actively correct the imbalance, but you want to do it in a synergistic and an integrative endobiogenic way, not forcing the physiology but by assisting multiple areas of imbalance to work more efficiently. And then you have quasi-pharmaceutical dosing, which is when this is the highest level of dosing. And this would be to get drug-like actions out of your prescription. And this is completely appropriate from an endobiogenic perspective, especially when the active disease is not responsive to a lower level of dosing like managing or regulating, or when there's no medication available to act in a pharmaceutical rescue type of way. So what are we talking about for dosing? Well, for managing, I would say 2 to 3 milliliters in a standard tincture, which would be 4 to 6 drops in the Endologica system. Regulating would be 4 to 5 milliliters. This is per dose, per dose. And in Endologica, it would be 8 to 10 drops. So what's written on the label is 6 to 10 drops per dose. So it's covering the higher end of managing up to the higher end of regulating. And you can guide your patient based on where you think they need to be. Also, people who are more sensitive to medicinal plants, especially to the dynamism and the potency of fresh plant material and these concentrates, are going to do better at 4 to 6 drops, and you'll get regulating effects if they're sensitive. And then quasi-pharmaceutical we could consider as 7.5 milliliters or higher. So with the Endologica products, that would be 15 drops or higher. Because of my training in pediatric critical care medicine and then my extensive experience treating neuroatypical children and other types of children in my outpatient practice, I've developed a dosing guide to help you safely uh, recommend Endologica products in children if that's appropriate for your scope of practice. I won't go through the details, but it's all listed here by age. And I use the body surface method to estimate metabolically active mass and to um, distinguish this from metabolically inert mass like adipose tissue. Now, this dosing guideline is generally appropriate for children of a typical rate of growth who are of Western European heritage because it's based on growth charts available in the United States, largely taken from this population. So there will be some variations that you'll need to determine yourself. But in general, what I want to tell you is that if you don't want to get into all this pediatric dosing, from the time a child is really 8 to 10 years old, and definitely from the time they're 12, they're effectively like a small adult in terms of their body surface area. So to be on the safe side, in children 12 and older, you can dose them like an adult. And if you have experience treating infants with tinctures, then there's some detailed instructions here and in the brochure in the catalog that you can refer to on how to um, offer endologica tinctures to infants. Let's wrap up this part of the talk with compounding. Um, Again, if you have a dispensary, you can still use Endologica products. I actually think it's going to be a positive addition to your practice because you can add one or two of these products directly into the bottle of your custom formulation. Any of you who have made a custom formulation know it can take an hour to an hour and a half between invoicing, calculating the cost of each plant, pulling the bottle off the shelf, measuring it, adding it, washing the bottles, creating a label, affixing the label. This takes a lot of time to make a custom tincture. And custom tinctures are at the heart of the highest level of endobiogenic treatment. I want all of you to become compounding pharmacists one day or to work with a medical herbalist who can make these tinctures for you. This is a beautiful, beautiful thing to offer your patients highly customized formulations. But sometimes there's something already made that works really well, and it saves you time and it saves your patient money, and you can enhance it. So here's an example. So we're talking about cost, convenience, compliance, and efficacy. So for example, let's say you have a 22-year-old woman and she has menorrhagia, she has depression, and she has SIBO, small intestinal bacterial overgrowth. Well, even if you didn't do, again, even if you didn't do any endobiogenic testing, like with Gemma, even if you're not clear on all the details of what's going on, as you look through the catalog, you're going to see that you can treat these disorders with a combination of Seraphyn and Toniquel, which again is that mellow flow health set. And again, just to remind you, Seraphyn has very strong central nervous system issues to address the depression, but it also has a lot of rebus nigrum. So it's going to also help with the depression in that sense. It's going to help with adaptation and adaptability. And the Toniquel is focusing on autonomic nervous system, SIBO, leaky gut, inflammation, etc. So that leaves the menorrhagia for you to custom blend yourself. So what you would do, it's a simple process. Take a 500 milliliter bottle, add 1 bottle of Seraphyn, that's 30 milliliters, add 1 bottle of Toniquel, that's 30 milliliters. So now you have 60 mLs in your bottle. Make your custom blend, let's say at 400 mLs for a total of 460 mLs, and simply maintain the standard dosing that you were going to use or increase it maybe by 10 to 20%. And now your patient has in 1 bottle 3 different treatments. Very convenient. In terms of allergens, the Endologica products are gluten-free, dairy-free, nut-free, and soy-free. I want to just bring up 3 caveats, and you'll need to decide if it's still appropriate for your patient, for your highly sensitive patient. The first is that we are using the buds of the hazel tree, but not the nuts. But it is possible, conceivably, for someone to be allergic to, if they're allergic to the hazelnut, maybe they're allergic to other parts of the tree. They would need to be tested for that to be ruled out. We use buds of the fig tree, but not the fruit, in case there's a fig allergy. The same facility that makes the Endologica products also processes whey and bovine colostrum, but these products are not made on the same machines as the Endologica products, so they're not exposed in terms of going through the same machinery to bovine colostrum or whey. All right, Brigitte, is it appropriate if we take a 5 minute break here?
Yes, can you answer a few questions? Like,
Definitely.
can a pregnant woman use Endologica products?
Oh, the answer is yes. I mean, if a pregnant woman can receive medicinal plants, she can receive Endologica products. I have to say that there is uh, a specific physiology of pregnancy that needs to be maintained, and each trimester has a specific group of hormones that are more prominent than others. So what I would say is if you're qualified and have experience in treating pregnant women, Endologica products can be part of your repertoire.
Good. Will you be touching base on the plants that come in each individual product?
Yes, that'll be what we'll do after the break.
Okay. Are there any contraindications with mixing certain herbs together?
Uh, there can be, but that's not my level of expertise. You'll need to consult the books because I don't know what plants you're going to be mixing together. But in terms of the plants that are mixed here, they've all been checked for stability and they're stable in their combinations.
And there is one question that is a very short, if you can give recommendation. For a 17-year-old teenager with anorexia who hasn't had her period for a few months, what products are suitable for her?
Well, let's go over the products, and I bet you're going to be able to answer that yourself. Because those of you who've been enjoying the Gemma Materia Medica know that it is an education in itself, and you're going to find this catalog to also be an education for you. Let's go ahead and take a 5 minute break, and when we come back, we'll go over some of the technical sheets. I'll show you how to read them, and if we have time, we'll do a case study.
Yes, and I would recommend you guys to think about some cases that you would like to consider to ordering Endologica products. And at the end, you can ask question Dr. Hedayat. So I will make sure you can ask that to personal recommendation.
Well, if it's appropriate to respond, I'll point you in the right direction.
That sounds good.
Okay.
Okay, so 5 minute break.
Right. Well, my friends, let's actually go through the line and understand what's in them. I won't be able to dwell too long on each one, but and then we'll get to a question that arose about Gemma and Endologica products. All right. So In the tape, what you'll find in this catalog is a more detailed discussion of what we've talked about today, the overview of the line, the dosing, the compounding, allergens, everything that we just talked about is recapitulated here. Then the next part of the catalog will have the technical sheets for each of the individual products. And then the health set technical sheets are presented in the same type of categorization that we talked about. So pediatrics, body, mind, mind, body. And you'll see the health sets predominate in this mind, body. And then at the end of the catalog, you have a quick selection guide and how to select the right health set for your patient. There's an order form with the pricing and some contact information. So let's go to the first technical sheet. Okay, so here's Catavance. Let's take a big picture view here. What you're going to see on the first page is the name of the product. You're going to have keynotes, what health sets you can find this product in if you're thinking about expanding the level of support you're offering. It's going to have a quick overview of what you can use it for, what are the general actions, what are the clinical indications, and then testing indications, including non-endobiogenic testing. On the second page, you're going to see a more detailed discussion of the neuroendocrine terrain, the emunctories by primary, secondary, and tertiary levels of support. You're going to have your dosing chart, the list of ingredients, the excipients with the precise amount of ethanol that's present, and any contraindications or precautions based on the most current search of the literature that we were able to conduct at the time of the publication of this brochure. So this is what it looks like. And since we're here at Catavance and somebody asked the question, if you have a C9 level adrenal fatigue, which would be the most profound type of adrenal burnout with low cortisol and resistance to adaptation, is it enough to just use Catavance? Well, let's look together and see what Catavance is actually all about. So the keynotes for Catavance are resilience, vitalizing, fortifying, and uplifting. You can find it in Bright Lift, Grow and Thrive, and Radiant Power. And the essence of Catavance is that it's a cortico-neuroimmunologic booster. Its Vance is advance, is boosting. So this product, for example, would be used in low cortisol states associated with one or more of the following: immune, cognitive, and intestinal dysregulation. So right here, we can just stop for a second to answer our friend's question. If you have this profound level of adrenal fatigue, is Catavance enough? Maybe. It really depends on the clinical picture of your patient. Because while Catavance is already anticipating that there's going to be immune, cognitive, and or intestinal dysregulation issues in this low cortisol patient, if the cognitive issues are also involved, let's say emotional, like there's a more profound level of depression with this burnout, you should think about using Seraphyn with Catavance, and that would take you to Bright Lift. If there's much more intestinal issues in this patient, then you would think about simply adding Toniquel. There's no specific one health set, but if they had the digestive issues, a lot of immune issues, insomnia, and they had indications of low thyroid state, like they're cold all the time, or they have difficulty losing weight, or they gain weight easily as well, well, then you're already at grow and thrive, because even if they're an adult, because that's the Catavance that we're talking about, the Levovance, which boosts thyroid and metabolism, and it has the Toniquel for the gut-brain axis issues. And then it goes through the actions, improves production of all adrenal hormones, inhibits histamines, interleukins, eosinophil migration, improves neurotransmitter activity. Clinical indications, adrenal fatigue, immune issues, EMF sensitivity included, urticaria, chemical sensitivity, leaky gut, brain fog, depression, emotional and mental exhaustion, these various uh, infectious disease issues that are the types that tend to be associated with lower cortisol. So chronic Lyme, chronic fungal infections, wet bronchitis, prolonged or recurring infections of a mild nature. So yes, you're going to find this product recommended by the Adrenal Balance Panel. Once I revise the allergy panel, it would also recommend this. EndoCheck will recommend it, and the inflammation panel will recommend it. Because this would be in the inflammation panel, a person who has a high histamine, eosinophilic type of inflammation with a low neutrophil to lymphocyte ratio, this product would be very appropriate for them for that type of inflammation. If you're doing, let's say, a salivary cortisol or a Dutch panel, low cortisol, a low cortisol to DHEA ratio, or an absolutely high DHEA would be appropriate. If you have somebody with a neurocognitive Lyme or neuromuscular Lyme subtypes, this would be appropriate for them. If you have on urinary neurotransmitter testing low noradrenaline, dopamine, serotonin, GABA, or adrenaline, or high histamine or PEA, this product would be appropriate for them. If they have intestinal inflammation, leaky gut, dysbiosis, fungal overgrowth, presence of fungal mycotoxins, this product would be appropriate for them. So how is it working? Okay, it's a systemic corticotropic regulator of adaptation and recovery syndromes. It works horizontally across the pituitary and radially in corticotropic management. So it's both adapting the vertical corticotropic activity as well as the intrapituitary response for a better coordinated endocrine response to adaptation. It improves noradrenaline, dopamine, and serotonin, and that's how it's going to be helping with brain fog, with attention deficit disorder, with other learning issues. It reduces excessive parasympathetic tone. This tends to be an issue with people with low cortisol. And they can have, of course, secondary elevated sympathetic tone to try to overstimulate the low responsive adrenal gland. And of course, it's an adrenal adaptogen, and it regulates ACTH, cortisol, anabolic steroids. It supports adaptive and permissive function. Its primary areas of emunctory drainage are liver and kidney, but it's also a strong skin drainer for people who have skin disorders or skin manifestations of their inflammation. But it's also a splenolymphatic drainer, which is really important with the weak immune system that these types of people tend to have. So what are we looking at here? The ingredients are listed in descending order from highest to lowest concentration. So we have blackcurrant or cassis bud as a gemotherapy. We have ginkgo, we have sea buckthorn, burdock, wild pansy. So these are your primary drainers right here. We have sea buckthorn to support the immune system in various ways. We have oak bud, Quercus robur. That's helping with that horizontal uh, and radial activity. And the ginkgo, the rebus is helping with the vertical corticotropic activity, and the ginkgo is helping with neurocorticotropic coordination. And you have pokeweed for lymphatic and splenic support. And then you have oak catkins for an additional level of immunoadaptive support. And then the contraindications are listed here. So this is an example of what you would be able to derive from the technical sheet. Let's go more quickly through the other ones. So we talked about Cataquel. This is a corticoneuroimmunologic regulator. So this is the mirror, not exactly, but it is the opposite of Catavance because here we're quelling the high cortisol state. So we're helping people feel more harmonized, soothed. It's more restorative, calming, and grounding. Okay. Let's just jump down and look at the ingredients. So here we have magnolia bark as the primary ingredient. This is going to be alpha sympatholytic, reducing cortisol. We have passion flower. Here are our primary drainers, dandelion and mallow. And mallow is also going to reduce inflammation in the mucosal linings of hollow structures. And then even, even though this is a quote unquote corticotropic product, heather gemotherapy is used here for a more subtle psychoneurological approach to reduce brainstem overstimulation, the source of the alpha sympathetic overstimulation of cortisol, and to reduce a sense of worry, to ease the mind. And then you have sequoia and dog rose to help support the recovery activity of the adrenals. And you have rowan bud for veno-lymphatic drainage. Now we go into the thyrotropic series. We have Levovance. So here we're going to be improving thyrotropic activity. So the essence is neurothyroimmunometabolic booster, advancing, clarifying, invigorating. So, and again, this is, you want to think about using this for cases of autoimmune thyroiditis. And here we have milky oat, and we have two forms of it. We have the shoots and the roots, which is a gemotherapy preparation. Let's see. We have Irish sea moss. We have bacopa. It's going to help both with antibodies and with cognitive function. We have white ginseng, again, for energetic support. So, technically the ginseng is not only supporting the thyroid, but also gonadal androgens and cortisol. So it's really working across the three axes. We have, again, our drainers, our primary drainers, birch and milk thistle. We have bean pod, which is going to also be an antibody drainer. We have bladder wrack as another source of iodine and other trace sea minerals. We have black seed for more antibody support, inflammation, joint issues. We have birch sap for revitalization. And then we have the more traditional preparation of oats, milky oat, stem and leaf as a mother tincture. And then again, the second in this series would be to calm down overactive thyroid activity. This is Levoquel, and this is going to be for mental centering, emotional balancing, and calm poise. This is a regulator of the neurologic, thyrotropic, immune, and metabolic systems. The things that this is most critical to addressing, we're going to talk about in clinical endobogeny level 2 in our next course, not the one that starts in March, but the one that starts in early 2027. It doesn't mean you shouldn't start using it now, because as you can see, it's really helpful and you can empirically start to support fibroids, fibrocystic breasts, ovarian cysts, cystic acne, anxiety with arrhythmia or tachycardia or diarrhea, difficulty with decision making, traumatic rumination. So if you have somebody with a strong trauma component to their condition, especially if their cortisol is high and their TSH is low, this product is going to be very helpful for you as part of your healing plan. You can use it for oligomenorrhea, for this specific type of PMS, hysterical emotionality, tearfulness, vivid dreams, sugar cravings, etc., breast tenderness, abdominal cramps. So there's a lot of uses for this more than just the thyroid. And while we're going to be teaching some of these later on, you can start using it right away as a complement. Again, here's the testing indications. So what's in this product? We have some really classic endobiogenic plants to reduce central endocrine overactivity. We have gypsywort, peachy, motherwort, corn, rootlet. So this is really all focused on excessive FSH, LH, TRH, TSH. You've got the whole combination right here. For the typical inflammatory terrain with high insulin, low insulin resistance, we have turmeric root, we have ashwagandha to help give them a sense of grounding, because these people tend to be vata. I would say in a Ayurvedic sense, if I'm not using that correctly, somebody can let me know, but I see them as really being having a lot of air, being in their head, being very anxious, being very startled. We have cleavers, birch. So here we're getting into more of our drainers. But corn is also a hepatorenal drainer. We have Melissa as a thyrotropic adaptogen. We have chaste tree as a gonadotropic adaptogen. And we have Fritillarium bupleurum for many reasons, including thyroid antibodies. And we have the lovely linden bud or tilia to help with anxiety and reduce stimulation of the central thyrotropic hormones. We have two more of these to go. We have Toniquel. So remember, this is the gut-brain axis oriented one, and it's found in 3 different health sets. It's really about unwinding, soothing, easing, relaxing, and comforting. So what's in this? It's German chamomile, hawthorn, eleutherococcus, valerian, milk thistle, agrimony, burdock, red root, and French tamarind. So the German chamomile has many actions on the reducing sympathetic tone, reducing inflammation, improving digestion, regulating dysbiosis. It's going to help in all cases of spasophilia. The hawthorn is there as an adrenaline regulator. So this is going to help in all cases of spasophilia and high adrenaline states. Eleutherococcus is here to improve adaptability in the immediate adaptation syndrome. The valerian is here as a general downregulator of excessive sympathetic tone. We have milk thistle as a great liver support. We have agrimony, which is a beautiful and complex liver, kidney, endocrine, exocrine, pancreatic support. Agrimony also helps in cases of high brain serotonin that you would find with sensory integration, which is one of the important reasons that this product, Toniquel, is in the Grow and Thrive for kids on the spectrum, because they tend to suffer from high brain serotonin, at least on endobiogenic testing, and clinically they appear that way. So the agrimony is there to help regulate the intestinal brain serotonin balance. And we have burdock and for really good hepatorenal, hepatosplenic support, and red root for spleen support. Because when you have spasophilia, the liver and the spleen can be congested or impaired in ways that can affect adaptation, immunity, and general longevity. Now, French tamarind, I'm not going to go into this too much, but what I want to tell you is it's kind of the secret ingredient that makes Toniquel so profound at a psychological level, even though it's also a splenic drainer. But whenever you have a patient whose tension involves a sense of feeling coerced or compelled to do things, or just miserably having to go through the same thing throughout life, the French tamarind really helps reduce the intensity of that misery and resentment and resistance. And finally, we have Seraphyn, which you'll recall has the strong autonomic nervous system activity, but really it's a psychoneuroendocrine immune regulator. And it gives a sense of tranquility, confidence, serenity. It's comforting and uplifting. So what are all the little lovelies that are in this product? Well, it's neurotransmitter focused, but it's not exclusive because actually the top ingredient is again Ribes nigrum for its general adaptability. But a lot of the neuropsychiatric conditions are very closely tied to either high cortisol or low cortisol. And Ribes nigrum as a cortisol adaptogen is going to lower cortisol in high cortisol states, and it's going to improve it in low cortisol states. You really can't go wrong with Ribes nigrum. And then there's lavender, which is absolutely essential. And once again, we have the agrimony here. And as I mentioned, agrimony is a helpful um, serotonin equilibrator in cases when the serotonin is already too high in the brain. Agrimony can help lower it. If the brain serotonin is low, it's not gonna reduce it anymore. It's only going to do this in cases of excessive brain serotonin. And this has to do with glucose management, but I won't go into the details of that now. The Liffy bud is very important here as a TRH regulator, but specifically related to traumatic rumination, to overperception, to people coming to conclusions too quickly. The turmeric is here because of the important role of neuroinflammation in neuropsychiatric conditions. The black mulberry root is here for glucose regulation, which is important for people with these types of imbalances. Here's the hazel bud that we talked about, which is a really beautiful neuropulmonary cardiac drainer. People who sigh a lot, who tend to have little PVCs or forget to breathe when they're anxious and kind of with a blank stare in their face. It's for these types of people. And there's the French tamarind again. We talked about why that's important. And there's also saffron to help with serotonin, with dopamine, with oxytocin, with all these things. All right. So now we get to the,
Yeah,
yeah,
can we just bring some clinical questions that people already have? I
yeah,
mean,
mhm,
just start to think about those products and what could be
yeah,
good for.
love it. Okay.
So, can the growth factor be stimulated in a 17-year-old boy who wants to be taller using one of these products?
Um, it's possible with the Rebus nigrum. Actually, Catavance would probably be the safest way to do that because the oak as a horizontal stimulator is going to get to the growth hormone. And because of the function of Rebus nigrum and the cortisol growth hormone relationship, the Rebus nigrum and the Quercus in Catavance, this one, right? Nope, right here, Catavance. Cassis, we have Oak Bud and Oak Catkins. This would be helpful. And what I would say in this specific case is you'd also want to add some zinc and arginine. But if
Okay.
you're talking about getting a 17-year-old to grow, it's generally too late. I mean, there are some late bloomers if it's a boy, if he's not already at the height of his mother and there's still some potential for growth, yes, you can do it. But probably 14 was the age you would really want to be working on that.
What do you recommend for a 20-year-old boy who feels lacking in vitality, has no energy to do small household chores or even watch a movie? His memory is also not helping. He suffers from headaches and constipation and has halitosis.
Okay, well, you talked about a lack of motivation and you talked about a sort of a sense of blahness. So that sounds like you could use Catavance or you could use, which we just talked about for boosting the corticotropic axis, but also Seraphyn. And if you want to use that combination, this is a great time for us to get into the health sets. That would be Bright Lift. And let's see if that's right for this poor young man who's suffering so much. Milk flow, Bright Lift. Okay. Right there it says motivation and mood, renewal of emotional, mental, and physical type. So it's Seraphyn and Catavance. Let's look at it's indicated for patients suffering from depression, lack of motivation, focus, or confidence, underpowered corticotropic signaling with secondary neurotransmitter disruption, conscientious, sensitive, idealistic, appears sad or depressive, social anxiety, self-conscious in public settings, lack motivation to start or complete tasks, lackluster, sluggish, their inner critic or shadow consciousness is prominent and pessimistic. Do you know this young man well enough, whoever asked this question? If
That
could you,
was Janina, Tatiana, and Nita.
okay. Do you know this patient well enough? Do they have these other qualities? Their depressive type is psychomotor, hypersomnia, slow moving, slow thinking, lack of interest. You could this would certainly be a good combination because remember the Seraphyn already has that really good corticotropic support in it. So you wouldn't, but when you add the Catavance as well, you get a beautiful thing. But you also mentioned something else, Giannina, which was like, oh, constipation and halitosis. So maybe what you want to do is use Catavance and Toniquel. And if they have constipation, they could be hypothyroid. So if you haven't done testing, if you're not going to do testing, if they refuse to do testing, honestly, I would give them Grow and Thrive because it's Catavance, it's Levovance for thyroid support in case these headaches or the constipation are related to the uh, low thyroid activity, and then the Toniquel is going to deal with the halitosis and all the dysbiosis associated with that.
Um, Ruta asked the question, what combination of endological products is best for women with Graves' disease now in hypothyroidism and exophthalmos?
Okay, so if the patient has already been treated, what did they get, like a ablation or did they use iodine to completely shut? I mean, it depends on what happened, how we got into the hypothyroid state. Because, for example, the first thing you want to do is manage, if they're on medication, manage that medication. If they ablated or functionally destroyed the thyroid, so there's nothing to control, you want to still optimize thyroid management. If they're on thyroid medic replacement and they're still showing signs of functional hypothyroidism, you want to use Levovance. And you could use that as an individual product. So remember, the Vance means you're going to be advancing levothyroid activity. So neurorevitalizer, does she have any of these cognitive issues? Um, metabolic issues, weight gain. Remember, we're looking at milky oat, Irish moss, bacopa, ginseng. If we come here, we can see fatigue, insufficiency, asthenia, lack of exercise endurance, diabetes, obesity, hypercholesterolemia, atherosclerosis, executive dysfunction, brain fog.
She said that there is no treatment, only thyroxine for this Graves patient.
Well, so they were hyperthyroid. How did they get to the levothyroxine? Like, did they give them methimazole for a while or? use iodine at very high doses. Anyway, they're on levothyroxine now. I would do honestly, I would start with a thyroid panel, either quantitative level one, which just requires TSH, free T4, and free T3, or you could expand it to thyroid functional, which also includes LDH and CPK to get the thyroid index. And that will clarify if they need some type of optimal thyroid support.
Speaking on this on the thyroid topic, Camellia asked a question. When there
Mhm.
is a central hyperthyroidism but peripheral hypothyroidism, functional hypothyroidism, which preparation should we choose?
So you don't want to use Levoquel if you have peripheral hypothyroidism because this could slow it down even more. If you have central hyperthyroidism, like a low serum TSH or signs of high TRH activity and this weak peripheral thyroid, you need to support the thyroid and you need to do it carefully with Levovance, but then you use Toniquel to indirectly manage the central hyperthyroidism by keeping alpha sympathetic under control. That's what I would recommend.
And maybe one more, your observation. If there are no visible results within 3 months clinically, biologically, should the doses be changed or other preparations added?
Yeah, I'm not sure what you mean by no results because if the patient does not report improvement in symptoms, that's one thing. And then, but if, for example, you're using GEMMA testing or other testing services and those tests show improvement, but there's not clinical improvement, you've chosen the right products. Increase the dose or increase the frequency. There's some other questions. And by the way, Ruta, it's lovely to have you with us. Nice to have you and any of our other Lithuanian friends that I've met or haven't met before, our Romanian friends. It's good to have all of you with us. You can now we haven't gotten actually to I mean, we just started talking about the health sets. There are so many conditions that could be treated, and I did not list every possible condition. It would just be too long. But these are the big conditions you can treat. So let's take something like radiant power, which is Catavance and Levovance. Or so for example, you have a much longer list here. Polymenorrhea, PMS, very specific type, breast tenderness, food cravings, vivid dreams, bloating, amenorrhea, infertility, etc. My friends, just hit the Command F button in your Adobe Acrobat. Somebody wrote restless leg, right? Look at that. Is restless leg treatable? Yes, mellow flow. Okay. Is that the only thing that's going to address? And by the way, when there's a clinical indication, there are dosing protocols. So in general, you can do this. If you have these neuropsychiatric issues, here are some recommendations with some emergency or flare-up dosing. If it's neuromuscular, neuro GI, so I've given you dosing protocols to be as specific as possible. So, okay, restless leg is a neuropsychiatric condition that you can treat with mellow flow, which is Seraphyn, the neurotransmitter, and corticotropic balancer, and Toniquel, which is that gut-brain regulator. So it's a neuropsych condition, and you could give both of them mornings and in the evenings. With the insomnia, and I would say with the restless leg, you could just give it morning and 1 hour before bed. And if they wake up with restless leg, give them half to full dose in the middle of the night as needed. So you can just search through this yourselves. Not that I don't want to answer your questions, but when I'm not here to answer your questions, you can just search and see. And if something's not listed, let me know and we can improve the protocols in the future. What else? Okay, somebody asked about, Ruta asked about arthritis. So arthritis you can address with Levovance, especially when there's an arthrotic component like arthrosis with swelling, cold swelling, for example, ankle edema, arthrosis. Yes, exactly. So radiant power. Why? Because it contains that Levovance and it has Catavance. So if someone is generally weak in their adaptive, their catabolic axes, use radiant power.
There is a question.
Hmm.
For a patient who complains of severe heartburn and stomach pain every time she uses a tincture, do you have other suggestions besides taking with food, diluting with olive oil, or decreasing amount taken?
Yeah, I would have them try the Endologica products because they're going to take 4 to 6 drops, and tell them to try directly putting it under their tongue. Now it is a little tricky, I'm going to show you once again. Okay, if I squeeze, this is Catavance. Okay, if I squeeze the bulb, I mean, look at how much is in there. That is like 5 days worth of treatment. Okay, and it's funny because I've tried to give these directly under my own tongue, and Brigida's looking at me. I'm like, I just gave myself 6 drops, right? She's like, I think that was 20. Like I stopped counting. It was too many. I'm like,
It
really?
was a full
Like,
dropper, yeah.
yeah, but I mean, the point is, if someone has this trouble, what I would recommend is have them take 1 teaspoon of water and add their dose and just have them start with 3 or 4 drops of Endologica into that teaspoon of water. Put that teaspoon of water under their tongue, hold it for 2 to 3 minutes, as long as they can, and then swallow it. Okay, there is a question from Jacqueline Mariani. Okay, pourrions avoir des traductions en français de chaque produit, s'il vous plaît. Okay. She's asking if we could kindly have a French translation. And actually, Jacqueline, we can. Thank you for your interest. Actually, our in-house researcher and pharmacist is a native French speaker, and we can work on that translation. And you're welcome, Jenny. I would be excited to hear how that works out.
There are a bunch of questions on Q&A and interesting. I hope you can read them and address them.
Okay. All right. Maria Vargas says, why is there no combination of Cataquel and Levovance since I have several patients who get this recommendation? Well, Maria, I think that there may be a need for a health set like that in the future. The health sets do not represent every possible combination. They only represented what I thought were some helpful and evocative combinations where I could easily paint a clinical picture and inspire you to recognize a certain type of patient. But there's infinite variety, and that's why they're sold individually and not you can. It's not that you can only buy them in a health set. The health sets are just a state of mind. John August Rao says, any words of wisdom about learning and assessing potential herbal and prescribed drug combinations? My friend, there is for every plant. So let me pull up the Gemma Materia Medica in case you're not familiar with that. So those of you who are not familiar, this is a free resource that's available to anyone who has signed up for the Gemma bioanalytical system, and signing up itself is free. So what you'll find here is a listing of the plants and mushrooms that are recommended in the Gemma biology of function system. If we take one of the plants we were talking about today, let's take burdock. You'll see it mentions the Endologica products you can find them in, the panels, the indexes in the panels, and what the results are. But getting John to your question, you have the actions, you have the indications, and then you have precautions. Of course, this is an evolving science and there are new medications, and there's not a perfect database. But there are databases available that you can look into and you can subscribe to some. And we do our best to take it very seriously, the interaction between medicinal plants and each other, and between medicinal plants and medications. And every panel in the GEMMA system at the end also reviews the specific interactions that may occur between the different products that we've recommended within that panel. Hi, Julian. So happy to have you with us as always. For recalcitrant tinnitus, I would say that Rowan is going to be an important part of that. If we jump to Rowan, let me do it this way. We'll get some ideas of some nice combinations to use. So sorbus, sorbus, sorbus. So this actually, it's been revised. It'll say sorbus acuparia, which is Rowan. The domestica is actually the service tree. But we see here tympanosclerosis too. You can add viburnum lentianum. Um, let's see, circulatory, restless leg. I would still consider using this for tinnitus with Juniperus communis and the magnesium cobalt, Julian. I found that helpful. You also need to add some tilia. Okay, 33-year-old female with ankylosing spondylitis, affecting the lower spine. Okay, so this is nice. So you see right here, this, okay, you can't see this. Maybe you can. It says there's a 33-year-old female with ankylosing spondylitis, mainly affecting the lower spine that interferes with sleep. Having hot, cold baths before bed helps. Okay, hot and cold baths are basically breaking up a neuromuscular spasmophilia. So boom, add Toniquel. Ankylosing spondylitis always involves a high cortisol, high alpha person. So boom, you're going to add what? Cataquel. Cataquel is going to quell the catabolic cortisol activity. So Toniquel plus Cataquel. That's what I'd recommend. Uh, Maria asks, are there protocols for nodule cysts and fibroids? Yes, there should be. Let's go back to the right product. Quiet strength, uterine fibroids, fibroid cysts, la la la. Yeah. Immunogen, onc, etc. AM and early evening. So quiet strength is Cataquel and Levoquel. So this is about reducing excessive catabolic response. Well, my friends, I had a case study for you guys, but you presented your own cases, which is really nice too. And oh, hi, Anna. Thanks. I didn't realize you're the anonymous. Great to have you. Jacqueline Mariani, je vous en prie. Okay, my friends. I think we're going to wrap it up here. I'm going to let you enjoy your evening if
Do
you're
you
in.
are you gonna touch on the health sets and like
I
and
did touch
that's
on the health sets. Was
and about those forms at the very end of the
why not? Let's do it. Um, yeah, I hope you enjoy reading these different vignettes and the pictures for these different types of people. Because when you see a person who's always holding their neck or rubbing it while they're talking to you, you're never going to forget mellow flow. You know what I'm saying? Or you see someone who's holding like this or like this while they're talking about tough emotions, or they're walking down the street with that blank stare and their fists are clenched. You're never going to forget the picture of what health set you need. Okay, well, let's talk about.
I'm just gonna let everybody know this catalog will be shared with you guys. It will be uploaded in Gemma system as well, so you can access it anytime you want.
Okay, and I will point out at the very end of the catalog, I know we've gone through a lot, and it's not easy to remember the individual products right now and the different health sets. So at the end, you'll see a quick selection guide and it for Grow and Thrive, for Radium, for each of them, it reminds you what's in it. And it'll say, choose this for this type of person. Choose this for this type of person. And it's broken up in the same order we've talked about. Here are all the Seraphyn based ones, and it'll say, choose it for this, choose it for that. And then there is a quick table that's even more summarily written than what you just saw. And so it says, boom, grow and thrive, this type of person, this type of terrain, this type of clinical focus. Okay? Keep this handy with you. And here's the order form. So these products, even though they're only one ounce or 30 milliliters, because they're 10-time concentrates, at 6 to 10 drops, which is the typical dosing range, it could last as long as 5 or 6 weeks. So your cost as a practitioner is 40% below the retail. So it's $59.33. The minimum order, they're all the same price. The minimum order for you to receive this discount is 9 products, and that includes free shipping anywhere in the world.
This is let's because there are some questions about the pricing. This is for practitioners only, so you guys all qualify for it. If you order more than 9 products, you get 40% discount. So like whatever is on the website, it's more for the patients, for general public, but you guys have special discount.
And
That's
you
correct,
will
right?
also be, in the next month or two, you'll be able to log into Gemma and have your own professional e-commerce access to all these products. But you will find at the end of the catalog this order form, and Brigitte will be sending you an Excel spreadsheet you can fill out. It'll calculate how much that's owed. You just tell us who you are, what your Gemma email account is for verification, your company or clinic name, and where we can ship it. And then you email it to orders@endologica.com. And here's some contact information.
I want to say about the shipping. So currently, well, in United States, it's free. I mean, and it can be shipped already next week. In UK, we have all system in place, and we're working with DHL shipping, and it comes in actually 2 or 3 days, business days, the packaging. For the rest of the Europe, we're still waiting for import tax ID, which hopefully it will come next week. But if there is not such a quick turnover to send your package, it's because of that situation. Because we want to have it all done, so when you receive a package, you don't pay anything because all we paying all those import taxes. So you just get the product. So I will. If your package has not been sent yet to the rest of the Europe, like Romania, it's we are working on it and we'll keep you posted.
Thank you, Brigitte. Is there anything else we should be addressing today?
No, yeah, I mean, lots of great questions. Please bring that in the WhatsApp group, in the forum, who has access to it. We it's we are really excited to share those very powerful formulas. I mean, I was blending Kamyar's tinctures for his patients for few years, and I know, like, I can recognize that it's very Kamyar's signature blends, and which is very exciting that it can be available so globally and to everybody.
Thank you so much for attending. I'm honored by your interest and enthusiasm for the products. I can't wait to share them with you so you and your patients can benefit from the experience that me and my patients have had, and you can bring a whole new dimension of healing at the level of the disease, the person, and the psychological configurations that are affecting their quality of life. And with that, I wish you all a wonderful afternoon and evening wherever you all are in the world. And thank you so much for joining us.
Sorry, I was just responding to the yes. So let's keep the conversation going and the emails on the chat groups, and we are here to help you guys, and you are helping us by improving our what we do, and so we are here to work together as a community.
Well, we'll see you soon, and we can see you on WhatsApp anytime.
Yes.
Bye bye for now.
Bye.